Good morning, I'm Dr. Molly Lee. I'm a medical oncologist currently working in the Chinese University of Hong Kong, working as a clinical assistant professor. My research and clinical interest mainly lies in thoracic cancer and including drug development, biomarker development, as well as lung cancer screening. So thank you very much, and I look forward to the discussion. Right, so lung cancer is actually ranks top of all cancers in terms of incidence and mortality in China as well as East Asia. So one peculiar phenomenon in East Asia is that we have also a high incidence of non-smoker related lung cancer. Close to half of the population is of lung cancer patients actually non-smokers, which is quite different from that of Western population. So this group is associated with Asian ethnicity, with the female gender, and the high incidence of EGFR mutation, as well also associated with family history, and recent evidence also show that it may be related to air pollution exposure, including PM2.5. So there's also emerging evidence in doing screening for these high-risk non-smoker subjects, because there is no such evidence in Western countries right now. So overall, this demarks the landscape of the lung cancer in the Asia-Pacific region. And of course, with the high prevalence of EGFR mutation, as the community may know, this is actually the first the first gene that has approved targeted therapy. And the prevalence is very high in East Asia, up to 50%. So I think the first and foremost for our patients with newly diagnosed lung cancer, the key is to hunt for an EGFR mutation first. And then, of course, the rest of the mutations are also equally important. It's very common. It's very common because we acknowledge the importance of liquid biopsy. The technology is mature, and also particularly in China, because the liquid biopsy is actually not that expensive. It's actually quite commonly used, although it may not be reimbursed for all the population. Outside China, for example, in Southeast Asia, in fact, the affordability for a liquid biopsy NGS, which means the pan-genetic testing, may be less affordable to the population. But at least we also do use a lot of liquid biopsy using PCR technology just for looking at the EGFR mutation. So you pay less, just hunt for a single gene, but at least for that gene, you have a good liquid biopsy to look for that, and there's a reasonable chance you may be able to find a targetable mutation already.